Council, items to be pulled? Questions? Seeing none, I'd entertain a motion.
Mr. Mayor, I make a motion to approve the consent agenda as presented.
So moved by Mr. Thompson and seconded by Mr. Reeves. Vote, please.
Shannon?
Yes.
Long? Yes. Thompson?
Yes.
Wood?
Yes.
Gurley?
Yes.
Kip?
Yes.
Stevens?
Yes.
Reeves?
Yes.
Motion passes.
Very good. I'll go ahead and ask the Health Department if you'd like to go ahead with your presentation.
Mr. Mayor,
Yes.
point of order. Did we have a citizens' concerns tonight at all?
I was going to do that right after them. Yep.
Okay, I apologize.
Excuse me. Okay. Great. And can you hear me here? Can you hear me if I speak from this far away?
Yes.
Okay, great. Well, thank you for this chance to come and speak to you all. My name's Wesley McCain. I'm the Policy and Development Manager at the Public Health Department here at the UG. And I'm joined with my colleague, Colleen Kelly, who's our ARPA coordinator. The Health Department, the Unified Government received about $88 million from the American Rescue Plan. And the Health Department was allocated 10. And that's a significant amount of funding. And so I think you all were curious about what we were doing with it. And so we were asked to come and give an update about our projects, where we're at with it. And so we have a pretty breezy update here. We're going to present for about 20 minutes, and then we'll have about 10 minutes for questions from you all. So just getting started. So real quick, okay. I don't know how to, it's kind of the big screen on mine, so I'm not quite sure how to do that. If you all are okay with it, is it okay on you all's screen?
We're seeing your cover sheet still.
So I think it's fine. I think it's just maybe up here. It's got the. Sure. Yeah. That's fine. Yeah. Yeah. Perfect. Next slide. Thank you. So we're going to talk about the health department projects today. There are other projects that are funded by ARPA that the Unified Government is working on. But I work at the Health Department, so we're going to talk about those. We're going to focus on Bonner Springs, the impact of the projects we're working on Bonner and Bonner residents. And then we're going to talk about, we've received our funding in September of last year. At the time, we're still working pretty hot and heavy on COVID. We still have a lot of COVID mitigation work going on, vaccination, testing, things like that. So we've had to roll out some of the other projects that we got funding for, so some of them they're in various stages of the process. So I'll explain that, and then we'll have a time for questions and discussion. So next slide. All right, a little bit about the American Rescue Plan Act. Next slide, please. So the Unified Government Commissioners established 3 goals, which you can see on the screen here. The health departments obviously falls mostly within community health and well-being. We do have some, obviously, that hit a little bit of the other ones, but as an entity that's focused on public health, we work mostly in that bucket on the left. Next slide, please. So American Rescue Plan, you all remember, is a big act, $1.9 trillion in March of 2021. And the pocket of funding that we got it from is just one pocket from that big, larger act that came to states and cities and counties. And I know Bonner got some funding, Edwardsville got some funding. So you all have probably been briefed some by staff about how it works and maybe have looked into it. But I'll just give you a brief overview. So the eligible use categories, there's kind of 2 things. There's what you can spend the money on and then who you can spend it on. And you can see here, it's fairly broad. There's kind of these two, well, probably 4 big categories here. I know there's 5. The 2 there are kind of linked, second and third. Public health, we've spent quite a bit of money just on fighting the virus, vaccination, testing, masks, communications to our residents about it. And then there's, in addition to fighting the virus, we have quite a few projects in this social and economic recovery part of ARPA as well. They put items in there when the pandemic hit. People lost their jobs, people were displaced, people were kicked out of housing. There were people, especially people who weren't doing as well before it, when there was that big pandemic, then people who didn't have as much often bore the brunt of it, and so they kind of wrote that in here into the act. And so you can see the different items that you can spend the funding on. And so some of those we have projects in. And then for the group of people that it's focused on, you can't spend ARPA money on anyone. They require that you spend ARPA funding on people who were impacted by the pandemic, and they define that as people who are low to moderate income, which is really nice for us. It's a pretty broad group, up to about 300% of the poverty line. So it allows us to, really work with a lot of people. That's not just very poor people. It's a group of people, middle class, folks as well. And so when you're kind of thinking about, the folks in Bonner who, most of the programs that we'll be working on will be focused on that kind of low to moderate income. You can't spend it on people who are high income. It was intended on people who were impacted. So little bit, and then I noticed that there's a presentation about infrastructure later. So then there's a different category, which I won't explain because I don't know much about it, and that's the infrastructure category, and I know there's a presentation that works a bit differently. So next slide, please. So that's a little intro, and I'll kick it to my colleague Colleen for some of our projects.
Hello, everyone. Good evening. Thanks for having us. Next slide, please. So the first project we wanted to highlight that directly impacted Bonner Springs was the COVID-19 mobile vaccinations. That is still ongoing. You can see the numbers on your screen of folks that were served in your community at events, businesses, and at-home visits, and that's homebound and others that need those services. We're continuing to do that. And then, although I call it Bonner Springs adjacent, we did have some events out at Sporting and some incentives where folks got a lovely scarf if they got vaccinated. And Monarchs Games also had lots of events with us and did some partnership with us. Next slide, please. So one of our big efforts was the COVID-19 KN95 mask distribution, and we did that throughout the county. We worked really closely with the Bonner Springs Library. They actually ran out of masks, so we had our folks come and bring some more out. And these efforts are continuing in things like test distribution. So if you hear about federal test distribution, we are engaging in that process as well and working with some of these same external stakeholders on how to get tests out to this area. Next slide, please. One of the things that folks were challenged with during the pandemic is if they tested positive or they were required to quarantine, they were asked to not engage with others while we really didn't know the behavior of the virus at the time. So we've delivered food, PPE, cleaning supplies, and we've done that throughout the county, including Bonner Springs. Next slide, please. Other COVID-19 efforts were contact tracing. For instance, our contact tracing team contacts every positive patient within 48 hours and talks them through guidelines and quarantine, et cetera. And then we had 3 mass vaccination sites. The first one was at Kmart, the old Kmart on State Avenue. And then the second one was out here at the Legends, which again is not Bonner Springs, but it's more in the western part of the county. And then the last mass vaccination site was on the east side in the Armory. Next slide, please. So one of the things that we've really worked hard on is trying to mitigate those social determinants of health. And what we have done is worked with the Health Forward Foundation. They've given us a lot of grant money. We will continue that program as of July 1st and use some of our ARPA funding. Some of the rides that we've given to folks are to the grocery store, to job interviews, to other health appointments. And we're going to continue to try and do that and provide that service as that's been taken advantage of quite a bit. Next slide, please. So I don't know how many of you have heard of that story recently of the police officer in Kansas City, Kansas that had a negative reaction to an opiate, and we had a Narcan distribution plan with the police department, and we're continuing to work with that. We have a substance abuse counselor that's just been brought on board, and we're working on a deployment plan. Looking at schools, we haven't really firmed that up yet, but we're working on that this summer. We'll have a deployment plan, and we're getting training in the next couple weeks about Narcan and how to use it in the community, and that's something that we feel is a huge negative impact of the pandemic. As you can see, overdoses increased substantially. We know mental health has been a real issue with the pandemic, so we're hoping to address that through that effort. Next slide, please. Some of you may know the program of Women, Infant, and Children, or WIC, and that is a federal program that is usually housed within a county health department, and one of our ARPA-funded projects is to provide breastfeeding accessories like breast pumps or bottles or things that are necessary that we didn't necessarily have the funding for. And we do have Bonner Springs clients that are in the WIC program. So we think that that will be a great service to those clients to make that gap in supplies. Next slide, please. Another effort that we have done is our health education team. So they are, I don't know if you saw them at the last farmers market, but they're out here quite a bit and trying to educate the community about current issues around health, and that affects our community health effort that the UG identified through their strategic planning. So that's where we're at with projects that have occurred or are still ongoing, and then we'll come up, I'll come up a little bit later and talk about what's in the pipeline for projects coming up, but Wes is going to take it next. Next slide, please.
Thanks, Colleen. Yeah. So some other projects. The next bit of projects have either been partially funded by ARPA or funded through other COVID funding that we got. Next slide, please. So you all, I don't know if you've heard of our CHIP, that's what we call it. It's our Community Health Improvement Plan. Every 5 years as a health department, we do a big assessment of the county. We collect hard health data. We go out to different places in the community, including Bonner, do focus groups, talk to people about what their major health concerns are and their major concerns in general are. And Colleen mentioned the social determinants of health. That's a really important framework for us increasingly because we are looking at health outcomes and trying to figure out how we can move health outcomes that are pretty stubborn. You know, there's been health disparities among people for a long time, and people have remained unhealthy in lots of ways. And so this CHIP, more than others, we've really started to dig in a lot on what's driving those long-term low health outcomes in Wyandotte County. And so, you know, these are our 4 health areas that are in this, and these align. One thing that was really convenient, these align really well with the eligible use categories in ARPA. And so when the ARPA dollars came out, this was one of the ways that when we were allocated the funding, we looked at it and said, okay, we have a plan in place that's backed up by data, and we really would like to allocate some funding to this plan. And so we have lead agencies in each of the areas. The health department doesn't have expertise in job training or housing, and so we've found agencies that do, and we take a background role, we fund them, we provide planning, we help to connect them to government resources and things like that. And so some funding from ARPA has been allocated to these groups to help to fund this plan. So next slide, please. So some of that funding has just been core support to the agencies to do their work. There's some money that we've allocated to projects as well. And then I can't, it's a kind of a large plan with a lot of different strategies. And so I'm not going to go through all of them. They didn't all receive ARPA funding, but we did fund some of the agencies working on them. So I'm going to bring up a couple that are, I think, more pertinent. So next slide, please. So another transportation, you saw transportation before. A lot of residents talk about transportation being a barrier to be able to get where they need to go, whether it's a doctor's office, job, other places. So this is a safety net. So a lot of people who are lower income in our community rely on safety net healthcare. SWOPE, you've probably heard of some of them, SWOPE, Vibrant. And so this is a program we're rolling out in August, and regardless of income, insurance status, immigration, anyone can book a trip door to door to a safety net healthcare clinic, which the clinics are really, really excited about this because they see a lot of people who need healthcare. They have a hard time getting there. And a lot of people have mobility issues. People who use healthcare more often it's kind of a, devil's problem where people who need it the most often have the hardest time getting there. And so we're just really excited that we're able to provide this service in a couple of months. Next slide, please. And then here's another one. This is in our Access to Living Wage work program that we're working with the Economic Development Council on. People who don't speak English as a primary language have a difficult time moving up in a job. They're kind of stuck sometimes if they don't have the English language skills to become a foreman or a manager or a supervisor. And so we've rolled out with the Economic Development Council, the community college, and we're working as a funder of this, a program that we provide ESL classes on location at the businesses. They provide the location and they pay the employees during the instruction time. We provide the instructor and the structure for it. And we've started with 3 businesses. We don't have any in Bonner yet, so one of my pitches is if you know anyone who has a lot of employees that don't speak English, we'd love to come and talk to them about this. But the 3 businesses have really loved it. It's really been a good service to them. They've enjoyed it, and their employees do too. So next slide, please. And then community health workers. You can kind of read in that box what they do. They are like social workers, not as much training, but they serve to help people navigate resources. Again, you can see that we have a lot of things that help people get to the resources they need. We have resources, but people sometimes don't access them. We have access problems. And so we have a program that the Community Health Council of Wyandotte County runs, and the funding source did not originally, it was exclusive to Kansas City, Kansas, so we took some COVID funding and added a Western Wyandotte component of it to make sure that we have health workers that can serve residents here in Bonner and other parts of the county here. And there's one, I don't know who they are, but there's one I know who serves here at the City Hall. You may have met that person, but they're here helping clients. And so we've served some folks with that, and we will continue to do that as long as we have the funding for it. And next slide, please. And what's next? Colleen.
Well, lucky you, I'm what's next. So next slide, please. I know it's a long night, so we appreciate your time. We're almost towards the end. So the future ARPA projects that are in the pipeline, they're getting RFPs vetted. We're getting stakeholder engagement. Our low-income legal assistance, again, county-wide, and that's for folks who are having tenant issues or job issues and needing legal assistance. And one that we're really excited about that we're working with the head of the WIC program is a mobile grocer. And so, again, going through the RFP process right now and hoping to get some kind of infrastructure built up with someone who's already providing that service so that we can then have locations throughout the county that would help bridge the gap of food instability. And then similar to our COVID mobile efforts, our mobile vaccination efforts, we're hoping to do a mobile medical clinic, and that would not just be COVID vaccinations. That would be childhood vaccinations, that would be other health issues that this person could see in a mobile setting like a van, et cetera, that they could go to all parts of the county and address issues on the fly with those folks. And that's, next slide, please. And that's where we are for things in the pipeline. As you know, ARPA is a 3-year, one-time fund opportunity. And so we're hoping to find additional funds and leverage that money with other foundations and grants to make those dollars go further and be efficient and try to serve the county as much as we can. So what we're wanting from you guys, we have a request, is how can we help communicate this information more readily to your constituents? And how can we get the word out in all parts of the county? You're fine. And that's one of the prompts we'd love during the question and answer session, if you guys want to have a moment to think about that. Next slide, please. And we're open to questions. Before we get to questions, I'd like to acknowledge that we have Gwen Thomas in the audience. Gwen, would you be so willing to stand up for a second? So Gwen has just come on board. She's been with the UG for a long time, but she's come on board in a new role to be the UG ARPA coordinator. So as you know, the health department has a slice of the pie, but the entire UG is taking in applications and take from nonprofits and from departments to do other ARPA projects, and Gwen will be managing that process. So she and I have become best friends over the last few weeks, and we hope to really deliver a really great service to the county. So we're open to questions at this time.
I have one. Have you made a direct connection with the guidance counselors at every school?
Well, our education team has worked with the schools. They have volunteered to come out and do, service as well as programming. They're really looking at what are they doing in the fall. We have some ideas around STEM education and doing some projects around air filtration, but that's not launched yet. So they plan on doing that this fall. But the education team has reached out to multiple school districts and definitely Bonner.
Okay.
And that's one of the ways to get the information out, is not only through our school system, but also through, you can send information through the city websites and media outlets, as well as the library, and the library does a lot of education for community services. So you can provide that to both of those outlets as well. And Von Trent, you're very intimately coordinated with them, so continue with that. Other than that, if there's anyone else that knows of other ways to get the word out.
Did you have something, Danny?
I have a couple of questions, comments. On the Transportation Assistance Program, how much notice is needed for people to arrange those rides?
It really depends. We've had rides in the same day, but with any kind of medical, I'm sorry, what?
Ideally?
Yeah, ideally, with any kind of medical appointment with the new Safety Net Clinic transportation, they will have to make an appointment with that Safety Net Clinic, and so that'll be a little bit more, able to be managed instead of this last minute kind of urgency. But we have done rides in the same day, and I do know that that's one of UG's Transit's challenges, is how do we manage that, because sometimes we show up and then people need ambulatory transportation and that's not who showed up. So we are still trying to kind of work through that a little bit.
And will there be a way for people to schedule that other than on the website?
They can call.
Phone number?
I thought there was, but I thought, well, maybe there's so many projects we have, I thought maybe I'm forgetting the wrong one.
Okay, perfect.
If you'd like, I can email the number to the manager, clerk,
Yeah, we'll share as much as we can. I'm excited that there is a presence in Bonner. If it's 8 hours a week, that's great. I'd love to see more. One of our big focuses has been meeting people where they are and getting the services to people. So the more that we can bring out here, I think it's going to benefit all of us, because we have so many people that can't get to the services in downtown Kansas City.
Definitely.
The last thing I thought of was when you're talking about the mobile medical clinic, is there any consideration to providing school physicals?
There has been talk of that. Like I said, it's in the pipeline, so it's way out, because obviously you need a clinician, you need planning,
Right.
you need strategy. We do have census tract data. We know where there's hot spots, but we need to do a lot of planning on that to get it deployed correctly. So, but there has been talk about it in the planning process.
That would be important with not only immunizations, but just general sports physicals. A lot of people that don't have regular doctors need someone to be available for that.
You know, that's one thing that we've talked about, and that's really good to hear that that's a need, because we've, in the early kind of discussions around this, they were talking about how neat it would be to park the mobile medical clinic near a school, right, and have some kind of schedule so that people, you know, whatever was needed, they could have it there, and they're, you know, instead of having to, you know, have it in a different location. So it allows us to do things like that we would not be able to do, and I'm really excited about that. That is a big project. We have to get a big vehicle for it. You know, it's an actual mobile clinic, so it's a little bit away, but we also like that idea. So
Thank you.
I do kind of want to reiterate what Councilor Gurley talked about, in that has been a concern for some time, that, you know, they talk about food islands for our low income. We felt like they were in a medical island out here, because all the services were being provided downtown and nothing on the western edge of Wyandotte County. So we're glad to see that presence come out here, and hopefully we'll have to work hard on trying to make sure that people are aware, somehow find ways of getting that word out to them. On the Narcan, you talked about that distribution program. Are you doing that with all law enforcement agencies in the county, or has it strictly been just the one agency?
I can answer that. So they're still in the planning process. They haven't really decided where the deployment is. It's just in discussion. So what's the plan? This coordinator just came on board. She's brand new, but we are more than happy to take that back to her. The thought was definitely work with law enforcement agencies as well as schools. That's been the discussion thus far, but nothing is set in stone yet.
Well, I mean, I know some years ago, we made the decision to invest in making sure our officers had Narcan. And I know it can be a little bit of an expensive program, so if we've got something that can help us with those costs a little bit, I'm sure our neighboring city of Edwardsville would love that as well. So we'd love any assistance on that.
yeah,
We will definitely take that back to her.
Thank you.
Yeah, of course.
Anything else? No?
Thank you.
Other questions?
Thank you.
Nothing else? Staff?
Just one question. Your CHIP program is every 5 years, right?
Right.
So is that one part of your ARPA allocation was to collect data post pre-COVID, obviously as well? When is that being undertaken, or is it currently being undertaken?
Yeah, it's getting kicked off right now. Actually, we have our CHIP is the second part of a two-step process. We do a health assessment,
Right.
and that's kicking off next month. We have a survey that's going to be sent out to the 1,000 households in the county. The statisticians do some fancy work to make sure that's representative of the county. Please don't ask me to describe how, because I don't understand. But they'll make sure that that is a representative sample of the county. And then we have some focus groups that we're going to be doing, including here. So yeah, that process is happening over the next 6 months, and that will then inform what will then end up being like the 2024 to 2028 plan.
Yeah, and I bring that up because I think that's a pretty important component that was funded as part of this, but also obviously has an impact both on the public in terms of what we're talking about is communication and outreach, but I think also to Councilman Stevens' comment, even just having an awareness of what our needs are locally with Narcan. I think I've got both my chiefs here. Those are things that obviously we don't deal with it at the same scale as other communities in Wyandotte County, but it's still an issue that has an impact. So
Right.
I think it's twofold as far as communication and then engagement through that. So that's great that you're doing it. I think now we've got that awareness. Anything that you can send to us that we can push out as well, I think would be extremely valuable.
Yeah, of course. I know those plans are sort of rise and fall on input.
Right.
And making sure that they're owned, right, by everyone in the county. So,
Yep.
yeah,
And I
definitely.
think probably coming back at some future point in time too with that, I believe that's approved by the county commission, but I think just having a presentation for the council might be worthwhile for, again, input awareness as well.
Yeah, definitely. We would
This is
love to.
This is really appreciated to have you come out and convey this information to us. It makes a huge difference, and helping our community recognize the value that we're receiving from our public health department is something that we need to continue to reinforce. I know, like, for example, the Narcan. We may be a smaller city, but I know it's not a competition, but our police have to deal with a huge amount of narcotic seizures, and the risk is always there. So we appreciate what they do. I know it's not a competition, but I think we probably would win anyway, per capita, but I don't want to say anything. And then our EMS is integral to all that too. So we appreciate you taking that back. As well as the health survey, I appreciate you guys continuing to do that and upgrading that. Hopefully that will be something that will continue after the funding, because our Wyandotte County has some very serious health concerns that are going to take a lot of public health intervention to remediate, and not all of it can be done very quickly.
That's right.
I know our community also has, Bonner Springs also has those same things, and I think to a lesser degree just because of our situation, but it's important to us as well.
Right.
And then, didn't you used to have a mobile health department RV or assessment vehicle or something?
That's what the mobile medical clinic is trying to do. We
Well,
do.
didn't they used to have something that would come out? Was that the health department?
That we had a mobile, it was like a van. It was that first part of the projects that occurred during COVID, but
Well,
it
I meant
wasn't.
even years ago that would stop by the library every once in a while.
And do.
It was almost a bread truck.
Yeah, and it would do like
Breast cancer.
breast cancer screening, blood pressure, just that kind of stuff.
Well, Wes has been at the health department over a decade, so I'm not sure.
A decade. Is it more than 10 years ago? Yeah.
Probably.
Okay.
What, am I crazy?
No. I
am crazy, but
yeah. No.
Okay.
but I appreciate any of that as well. Our community, as well as all Western Wyandotte County, needs it. So
Yeah.
thank you.
Okay. Yeah. Thank you.
Seeing nothing else, thank you very
Yeah.
much. Thank you. Appreciate
Thank
it.
you.
All right, moving along, our next item would be any citizens that would like to address the city council about items not on tonight's agenda. Is there anyone that would like to stand and address the city council about items not on tonight's agenda? These are things that can be brought forward to the city council about items not on. Seeing none, we'll make our way on to our first item of business. Our second item of business is the acquisition of real property. Staff?
Thank you, Mr. Mayor. Billy Knapp, Chief of Police. Have before you is a recommendation requesting approval for acquisition of 11600 Call Drive, the old Dr. Stolfus building, to be used as our municipal pound. We engaged in conversations kind of beginning in May of 2022 with Dr. Stolfus that property was available. Since that date, city staffs kind of went through that property with numerous trades to determine the viability of that property for that use. And the conclusion of that is that it would be good for that use. We did have an appraisal done as part of that assessment. It did appraise at $150,000, and the asking price is $149,900. So we would ask for the city manager to get authorization to sign and execute that real estate property acquisition.
Very good. Any other staff comments? Seeing none. Citizens, questions, concerns? Seeing none, I'd entertain a motion.
Mr. Mayor, I'll make a motion to approve the acquisition of 11600 Caw Drive for the amount not to exceed $149,900 and authorize the city manager to execute all required transaction paperwork for the sale of the property to the city of Bonner Springs.
I'll second.
It's moved by Mr. Shannon and seconded by Mrs. Gurley. We'll start down here with Mr. Reeves. Any questions, concerns?
I have none.
No question other than just comment. I'm glad we finally are moving forward with getting it out of the Sally Port. So we'll need that extra bay, I'm sure, at times. So.
Thank you, Chief. How's it looking as far as amount of renovation?
We provided some preliminary numbers, I think the last time we met on that. There are some things that need to be addressed. A dollar amount, we can be really extreme or we can be, get done what we need to. So it's kind of whatever funding's available. It's obviously a hot topic right now.
Thank you.
I'm glad it's going to happen.
Finally. Thank you.
Nothing else? Vote, please.
Reeves?
Yes.
Kip?
Yes.
Wood?
Yes.
Long?
Yes.
Shannon?
Yes.
Thompson?
Yes.
Gurley?
Yes.
Stevens?
Yes.
Motion passes.
Very good, thank you. Yep. On to item number 3, the American Rescue Plan Act, ARPA, funds for the water treatment plant project. Staff. A lot of ARPA tonight.
Mayor and Council, Tilly LaPlante, Finance Director. Before you is a motion to use the ARPA money that was allotted to the city for our water treatment plant. We were awarded $1.2 million last year, and we got half of that in a year ago, and the council awarded or approved using that for our current water treatment plant. And we're asking again, we just got the second half on June 18th, and we're asking to use that second tranche as well of $603,000 for the water treatment plant.
Very good, thank you. Any other staff? No. Comments, questions, concerns? Citizens, anything? Any questions, concerns concerning this? Seeing none, I'd entertain a motion.
Mr. Mayor, I make a motion to approve the use of the 2022 ARPA funds for the payment of a portion of the water treatment plant project.
Second.
So moved by Mr. Stevens and seconded by Mr. Thompson. Questions, concerns, comments, and we'll start down here with Mr. Shannon.
Nothing.
Ma'am?
Nothing here.
Nothing here.
Wow. Vote, please.
Long?
Yes.
Stevens?
Yes.
Wood?
Yes.
Kip?
Yes.
Reeves?
Yes.
Thompson?
Yes.
Shannon?
Yes.
Gurley?
Yes.
Motion passes.
Very good, thank you. On to item number 4, the Kansas Department of Health and Environment Water Plant Loan Agreement Amendment Ordinance. Staff.
Good evening, members of City Council. Frank Abart, Public Works Director. So you may recall a couple weeks ago we had a rather deep discussion about the KDHE SRF loan. We initially started and were approved for a $22 million loan. Since that time, we've seen the need to boost that to a total of $30 million. This ordinance in front of you is an amendment to the $22 million to get us to the $30 million. This is a fixed rate, 1.61% financing for 30 years.
Very good. Any other staff? Nope, nothing. Citizens? Concerns, questions? Seeing none. I'd entertain a motion.
Mr. Mayor, I make a motion to adopt an ordinance approving the state revolving fund agreement amendment with KDHE, increasing the loan amount from $22 million to $30 million for the water treatment facilities and authorizing the mayor to execute the agreement.
So moved by Mr. Shannon and seconded by Mr. Thompson. Questions, concerns, comments, and we started right here.
No, that was quite an article. I mean, quite a detailed, yeah.
We have the loan ahead of the project, I guess, which is a little different, but I don't know if this authorizes the project or the next one authorizes the project. I'm not really sure why the loan's in front of it, but on the overall, what is the cost per 1,000 gallons versus what Water One had? What's our estimate? I didn't see it in there, but there's 700 pages, so I easily could have missed it.
Okay,
we know
yeah,
what-
so this is the actual loan we're talking about here. The next item is the actual.
Yeah, I don't know why the loan's
But,
ahead of it.
but I'm not sure I can answer that question yet either, but
Okay, we'll answer it.
we did have a lot of debate, I guess, whether the loan goes first or the contract goes first. And
Yeah.
we ended up determining, well, if you don't approve the money, there's no need to bother with the project. So that's why they're in the order that they're in.
Okay.
And if you don't approve the project, we won't get the loan, so.
That's true.
Well, it doesn't, at the end of, we've already received the money. This is just an amendment to increase the amount. So certainly you could vote to deny this, in which case we don't have the funding to do it, and the other items are a moot point.
Okay, we'll do it the other way. Go ahead.
Nothing here.
Nothing else?
Nothing here.
Sir? Ma'am? Nothing? Seeing none? We'll go ahead and vote on this item.
Voting on a motion to adopt an ordinance approving the state revolving fund agreement amendment with KDHE, increasing the loan amount from $22 million to $30 million for water treatment facilities and authorizing the mayor to execute the agreement. Shannon?
Yes.
Reeves?
Yes.
Stevens?
Yes.
Long?
Yes.
Kip?
Yes.
Thompson?
Yes.
Gurley?
Yes.
Wood?
Yes.
Motion passes.
Very good. Okay, on to the next item, which is the whole kit and caboodle. Number 5, the water treatment facility project, sir.
Frank Abart, Public Works Director. So this has been an ongoing event, I guess, for the last several years, trying to get to this point. And we're finally at a point where staff is ready to recommend approval and moving forward with the development and building of a water treatment facility. It would take a 2-year project, so we're looking at the end of 2024. And all I can say is it's in the middle of some very tumultuous times. And we think we have a good plan put together. We think it'll work, and we think it can be done for what we're asking. So with that, I'll just open it up to questions.
Very good, thank you. Any other staff? Input, concerns? No? Citizens, questions, concerns, comments? All right. I will then entertain a motion.
Mr. Mayor, I make a motion to approve a contract with Burns McDonald CAS Construction LLC in the amount of $29,187,812 and authorize the mayor to execute all associated documents.
Second.
So moved by Mr. Reeves and seconded by Mr. Stevens. Questions, concerns, comments, and we hit everybody. We'll start here. Ma'am? Sir? We'll start down there with Mr. Reeves.
Yes, my question is, on this $29 million, is there any possibility through the financing and getting other types of financing along with this that we can end up with less than 29 million?
Are you referring to the Biden bucks?
That's a possible.
We are pursuing, in fact, we were just talking about that before the meeting, about some few other possibilities that are popping up, and we're definitely going to be pursuing those things. But yeah, until they become realistic for us. The fact is, if you pursued it right now, today, you would probably increase, and I'm going to go out on a limb here, but somebody can throw a shoe at me. You probably increase the overall cost of this project between 10 and 20% if you pursued that money because of the intense restrictions and requirements above and beyond what we're already having to pursue with the standard SRF.
Forget I said
Now,
anything.
there's efforts. That's, in fact, our discussions an hour ago, whatever, there are efforts underway to waive some of those things. And we will definitely want to be a piece of that if we can. But
yes, but
up to this point, it's been frustrating, maybe is the best way to describe it, for me anyway.
thank you.
Bob, I'll also, just because you asked the question, the unified government did open up an application to seek funding for their ARPA money for the county and the city. So I did make a request for funding support from the county for this project. So that's something that was completed on Friday of last week. They're reviewing that. My understanding is they'll hopefully have some sense of all the applications in the middle part of July. So that wouldn't have the restrictions that Frank is alluding to on the Build American, Buy American is what he's talking to. But again, we don't know that, but maybe put a bow on it. We're seeking all available funding that is advantageous for us to seek without having an undue burden on us in terms of the financial restrictions tied to it.
Nothing wrong with trying.
Right.
Oh, no, yeah. If it's there, we're going to try to get it, but it has to be worthwhile.
Yeah.
On the section for the, I think it was the liquidated damages, I'm having a hard time finding it right now. It mentioned, I think it was like 4 years for the build time, is that correct?
That doesn't sound correct. It's like 2
Did I
years.
misread that then?
2 years.
I can't find it right now. 2 years, so we are talking 2 years from the
Yeah.
time we,
No.
okay.
Oh,
But-
it's page 5, Tom.
Page 5?
Item 5.4 is liquidated damages.
Yeah, I think it's like a 177-page document, so I didn't print that and bring that with me.
Would have raised it to $30 million.
Yeah. All we know is you're talking 2 years, okay. May have done the incorrect math on it or such, but
Okay.
appreciate that, that's all I have.
That was kind of two parts of a question there. Did you have something about the liquidated damages?
No,
that you-
because I think that's the section I saw
Okay.
where they mentioned the
Okay.
time period, and that's why
I'm thinking
that's
it
why I
was
referenced it.
$1,500 or $1,600.
And I was just
$1,600,
curious
okay.
if it was
That
a
much I
date put out
remembered.
far enough ahead to make sure that in case there was any issue, that there would be some, little room for bad weather, other issues that might arise. But right now, it looks like two years from point of when we authorize.
Yeah.
We start moving forward.
Well, a little over 2, actually.
A little over 2.
When I said the end of 2024, I'm buying a few more months in there.
Gotcha. Okay. Thank you.
Yeah.
Frank, on the operating and maintenance costs for the year, it went down 5 million. How did we save 5 million?
Okay. I did bring extra copies for anybody who wants those, but this is what I sent out electronically is what you're referring to. The operating costs are because it was based on a lime softening plant. early on, 2 years ago. We switched to a membrane type plant, and the overall operating costs are less for that particular type of operation.
Okay, so it's
Over a
different.
40-year period, yeah, they're much less.
Okay, it was a pretty sizable move.
Yeah.
So I didn't know how we saved that in
Yeah.
that time. So what is the difference in the cost between the water one softened per 1,000 gallons? They're charging us 208, is that right? What do we estimate we're going to be able to produce it for?
Well, these are all over 40 years, the costs. Unless you guys can put your finger on it. You want to do it? Okay.
What it costs, yeah, we pay 208 from them, what do we produce it for?
Yeah, all of these costs that we produced, we're comparing 2 years ago, we did a 40-year cost to come up with the overall cost over 4 decades on the investment, so. I don't know that we narrowed it down to that level. You're digging on the web? Oh, okay.
We're going to be softened water, 35% cheaper. Well, sure, I'm saying what we have to pay, and what our end users get. So you're saying we're gonna build it for $11 million less over 40 years, as good or better water, I assume, for $1.50. Okay, that's all I had, thanks.
I'm trying to remember, when we did this project, the City Hall project, the design build was written such that we owned the design. If something happened with the relationship at the build, we owned the design.
Well, with this building, anytime that you're contracting somebody to do something, there's usually, I've seen this happen in other places where that argument comes up that you don't have access to that. Usually that's written into the contract that you're paying for a service, you get to keep that service. I think
Yes.
in this case, we had that issue occur where we went down one road and decided that was no longer a path we wanted to pursue. So we had all that information. That was ours. We purchased it. I don't think we had any issues with that and then move forward with somebody else.
The way I'm reading this, it shows that everything created under the design belongs to the design builder. Shall retain ownership of the property interest therein. So if something goes south after the design phase, we would not have access to that design. Am I reading that correctly?
You're reading it correctly, but you're not interpreting it correctly.
Okay, perfect.
But I'm not sure I'm the guy to explain this. Okay.
Translate, please.
I'm not an attorney by any, I'm Travis Stryker.
Oh, yeah, sorry.
With the design build team, and the intent is that, yeah, you own what you pay for.
Right.
So upon, if we were to part ways, upon compensation for the work that was developed, you guys would own that product.
Okay, thank you. That stuck out to me for some reason. I just wanted clarity.
Yeah.
Thanks too much.
I just wanted to congratulate whoever wrote this report.
All of them.
She's a teacher.
Yes. You wrote it very clearly, but the fact that there were a list of formulas and everything, and we have lousy soil around here, don't we? A lot of clay. And those pictures of it, and awful. And the word arsenic came up at one point, which of course we're taking care of with the
Yes.
everything. And North Chemical Room and South Chemical Room and But what I thought about with all of that science, I love the fact that there was an act against discrimination within that. I really appreciated that. So, A+ with extra credit. Okay?
You don't get an A+ very often, so. She finds all my misspellings.
Sir? Ma'am? Sir? Seeing nothing else, vote please.
Okay, we're voting on a motion to approve the contract with Burns McDonnell CAS Constructors LLC in the amount of $29,187,812 and authorize the mayor to execute all associated documents. Long?
Yes.
Wood?
Yes.
Stevens?
Yes.
Gurley?
Yes.
Shannon?
Yes.
Reeves?
Yes.
Kip?
Yes.
Thompson?
Yes.
Motion passes.
Thank you. Congratulations. Appreciate all your help. This is the start, well, the continuation of the start that we've been working towards and putting a lot of effort into. I know the city council takes this very seriously, and so do the citizens of Bonner Springs. Clean water is, I don't think everyone realizes how important it really is. But, and then the opportunity to have soft water in Bonner Springs will be life-changing. So we appreciate it. Thank you very much.
Thank you.
Fewer kidney stones. White clothing.
But,
Yes.
but does anybody else's stomach, are they in knots too? Is anybody else's stomach in knots? Yeah.
I know.
And the mayor has to.
It needed to happen.
Yes, it does. I'm making our way to item number 7, which is the North Park restroom purchase. Staff.
Hi, good evening, Mayor and City Council. Justine Spees, Recreation Manager. Before you tonight is the request to purchase a prefabricated restroom for North Park. This project has been in the works for a while, and I'm excited to get it going. The bid packet for the construction or the installation of this prefabricated restroom is out to bid currently. It should close July 12th. It's Tuesday.
Very good. Any other staff presentation or input? Seeing none. Citizens, questions, concerns, comments? Seeing none, I'd entertain a motion.
Mayor, I will make a motion to approve the purchase of a prefabricated restroom through CXT Inc. for the amount of $74,005.
Second.
So moved by Mrs. Gurley and seconded by Mr. Shannon. Questions, concerns, comments, and we'll start down here with Mr. Shannon.
Thank you. It'll be much appreciated up there. No more killing trees.
And it looks neat.
I like it. Are the simulated barnwood texture walls and cedar shake roof actually a composite material that can be power washed as needed?
Yeah.
Nothing, thanks.
Have you actually seen one of the structures yourself up close? I mean, is it sturdy enough it's going to last for a period of time up there?
This will last quite a bit of time. The National Park System uses these style of restrooms as well. I went to a conference way back in the day, 2016 over in St. Louis. They had a half of a structure there. It was really cool. Pretty easy to clean too. Just take a power washer in there. We did spring for the anti-graffiti, so hopefully that works out. So
Hopefully it won't be an issue, but appreciate that. Thank you.
Nothing else? No other questions, concerns, comments on this very valuable piece of additional asset to the city of Bonner Springs? Vote please.
Voting on a motion to approve the purchase of a prefabricated restroom through CXT Inc. for the amount of $74,005. Shannon?
Yes.
Kip?
Yes.
Thompson?
Yes.
Wood?
Yes.
Stevens?
Yes.
Gurley?
Yes.
Reeves?
Yes.
Long?
Yes.
Motion passes.
Very good. Congratulations. Something we can all enjoy. On to item number 8, SFS requests. Staff?
Excuse me. This is a continuation of a previous workshop. The item in front of you today is a three-part, I would say, request. One request is for roughly $2,700 related to the bidding and construction of the Government Services Center project. The second request is additional payments related to change orders at the expense of the city of roughly $71,000. And then an additional payment request for extended construction administration and expense to the city of approximately $22,000. Noteworthy, SFS is reducing that total amount of the request by $36,000 due to corrections at the Sally Port at the police station. Additionally, there is a request forward to have a 179D request for a federal tax credit, something that the city is not eligible for, but the request is being made that the city grant that to SFS and then Henderson Engineering. Since the workshop conversation and agreement has been put together, SFS has proposed it. I've included some changes. It's noteworthy that I have asked that if this is approved, that it is subject to the review and acceptance by the city attorney as well. So with that, that is all I have.
Very good. Anything else to add? Any other staff? Citizens? Questions, concerns, comments? SFS? Anything to add? Very good, thank you. Seeing nothing else, I'd entertain a motion.
See, it could go either way.
Yep.
Mr. Mayor, I make a motion to approve the agreement amendment number 6, providing additional funds to SFS Architecture in the amount of $59,966, conditional upon approval by the city attorney.
Second.
So moved by Mr. Thompson and seconded by Mr. Stevens. We'll go ahead and start with questions, concerns, comments right here. Sir.
I still have an issue with the with my hearing. Can't hear it on the extended construction administrative fees of $22,120. I'm still kind of stuck on that, and I know y'all talked about that. That's the builder. It seems like we're paying for the builder's extension or delay, and I know you all pushed them as hard as you could. I don't know what I'm saying. I guess what I'm saying is I don't think that should be included, I guess.
Good evening, Kerry Newman, SFS. We're very aware of the burden that both the city and we have had because of this extended construction period. I think we both really have seen that burden, and I guess what we've proposed is we feel like it's sharing that burden between the city and the design team. We've only asked for a portion of the time that we really spent. We're only asking for OAC meetings, owner, architect, contractor meetings, and site visits. So all the time that we spent in the office, we're not asking for that time. We also have only asked through October of '21. So all the time that we've spent since then is on our own dime.
I guess
so
I'm sorry.
I feel like we're trying to share that burden between the city and the architect.
I guess what I'm struggling with is why is the construction company not bearing some of the burden of this? And instead of us sharing it, how come the construction company that delayed is not sharing in this cost?
Well, I mean, I think they are in a way because of their general conditions costs that they're spending. I mean, they don't want to be out here any longer than they have to, just because it does cost them every day that they're out here working. work, and paying people to be out here. So, I mean, I think they are sharing that cost as well.
Sir?
Sean, in looking through all this stuff, I'm agree with Councilman Mike that could you pull this whole thing together for us? Because this just seems really, there just seems to be a lot of different paths and a lot of different intricacies, and I'm not sure I totally understand where all the confusion is, where all the things are happening. So could you, if at all possible, enlighten us from your standpoint?
Yeah, I mean, I think the general gist of the requests are because the project went over the time frame that was established and was accepted in the contract with the contractor. So I think Councilman Thompson's comments, that's very much, the issue is that the contractor is for lack of a better term, the one that's at fault for the extended time frame that we're still in, bearing in mind this project is not complete at this point in time. And there is no general contractor on site at this time either. So I think that's probably the biggest issue. The change orders, just to break them down, the change order requests, those are due. I think SFS has gone through and tried to, as they've said, have a tempered approach to the change orders that are being requested for compensation. I think I have in the packet the specific language that speaks to the increase or decrease of the project. So if the project cost goes up, the quote, should the budget be increased or decreased, the architect shall be entitled to, and the key word here is equitable adjustment in compensation. So equitable is assuming that you as the council and the architects can come to some sort of a determination as to what that means. Their approach has been, Dana, Carrie, do you want to talk about your approach to the change orders and maybe help explain that?
Dana Gould with SFS Architecture. Do you have access to this spreadsheet?
I believe
That's what Sean's referring to. This is our change order spreadsheet, identifying the roughly 160 change order requests that we reviewed. The line items that are in green are the ones that were approved. The ones in red were not approved. We typically categorize.
Dana, sorry, the sheet that she's referring to is CO approved request on the agenda packet. I think Chris is pulling it up as well for the audience. It'll be hard to read on here, but it's in the packet.
And I'm not going to go through, we've already reviewed all of these, but so then you see the column that indicates what we're basing our fee request on. So we're not asking for additional services for all of those ads. We're asking for additional services for the items that are either considered unforeseen conditions or betterment to the project. So had they been part of the project during the day of bid, you would have been paying for it then. Further reviewing the color coding, the items that are in yellow are for City Hall. The items in green are for the community center, and then the items in blue are for the police facility. So if you go to the bottom of the list, the original contract sum was that $13,961,117. We reviewed and accepted $1,028,883.18, and reviewed and declined the $742,114.59. So we're also not asking, the ones that were declined while we review those, we're not asking for additional services for that. We're only asking for the additional service for the change orders that were reviewed and accepted for the betterment and the unforeseen condition items. Yeah, so our fee was based off of an estimated construction cost of that $13,850,000, and it's within our contract that we can request additional services if the bids come in over that estimated budget. And so it did come in slightly over a difference of $111,117,000. And we're asking for an additional 2.5%, which would cover bidding and construction administration. We're not asking for the design portion of that fee, but the 2.5% accounts for the bidding and construction amount. Does that make sense?
Flasher go off. When you make, so when they review change order requests, you typically have a 5% or a 5% add-on from the contractor, 15% on the contractor. Do you have that? Is it typical for you to make that request now for the change orders after they're approved or when they're being approved?
We typically will talk with our client, like we did with you, and make that determination of when the best time is to make that request.
But you made the request to me for the change orders for the increase when 70, 80% of these change orders had already been approved.
I believe it was February of 2020 when we first discussed this list.
Right.
Yeah.
So most of those were already done. So I just want to, I bring that up just so you all have an understanding of how we've gotten that today. So I think to Councilman Shan's question, those are kind of the three requests there. And again, the fourth one is that $25,000 credit. Could be 25, I suppose, up to 25,000. I don't know if that's helpful or not.
Yeah, I'm just trying to put all this together as to what are we looking at cost-wise.
So again, the total, with all the considerations being made, what's being requested, less the credit for the Sallyport, which came, with the credit of the Sallyport, takes you to about $60,000 of additional funding to the design team.
Dana, when we were talking about the contractor, is this somebody you feel you want to continue with? You know, okay, that answer, I won't put you on the spot since it's on recording. I don't know, just sitting here looking at this, it looks like they've done disservice not only to you, but to us. Am I reading that correctly? Okay, thank you. Nothing further. Ma'am? Sir?
No, something I forgot to say a while ago that I want to make sure that both of y'all understand from my standpoint is that we have recognized the due diligence that y'all have put into this, and that, I do recognize that, but we're struggling with this other part. But I want to acknowledge that y'all's effort. I appreciate it, because I remember some of our previous meetings that.
Very good. Ma'am?
Since we're still not completed with this project, will there be additional time spent on construction administration and things? Are we going to see additional fee requests for?
There will be additional time, but we will not submit additional fee requests.
Thank you.
Sir?
Sean, is this a little different? Usually this comes with a recommendation. Is there some reason? I mean, this is so nuanced that you guys are in this day to day to day. I have no idea if it was necessary to, how much time it takes for that. So I'm kind of flying blind on this.
Right. I think the lack of a recommendation is somewhat indicative of some of the verbiage that's used. Again, equitable, I don't think is for me as staff to necessarily assign what's equitable. As I think we all know, and it just was spoken to, nobody here is faulting SFS as far as some of these issues are concerned. So, but I think, what you all consider to be equitable, I think needs to be what your all determination is on that. All things, again, being considered. I think that they've gone through on the change orders, as is evident. I think the approach could have been differently. As far as would you have made some of the decisions based on those change orders knowing that you were going to get tacked on another 10%? But that's not to take away from the other request within the change orders, how that $25,000 factors into the giant scheme. I think that question was asked at the workshop. Is that something that would be, I think Tom maybe had asked that, is that something that should be considered as part of this as a total package? And there's a lot to chew on there, and I think that's why we had it as a workshop, and kind of bringing it forward today without a recommendation.
Thank you.
During the workshop, I had two concerns. There was a couple members here on the council that weren't here for that workshop that evening. So the first one was because of on the change order of no money was being refunded on credits. But I thought you gave a satisfactory answer to that. But I thought for the other two council members that weren't here, you might be able to repeat that answer why there was no refund on the change order that ended up being a credit.
Well,
I think
Carrie,
I think Carrie's the one who actually answered that one. He might remember maybe a little bit more since he answered it. So.
Well, I will say a lot of those credits were based off of our working with city staff to do some value engineering to your benefit. So we still do the work to get there.
Right. I think that was what we talked about last time.
Sorry.
We still spent the time to review those change orders and vet them and
And like I said, I was
negotiate on
satisfied
it.
with the answer. I was asking that again for two council members that weren't here present at the time.
And if I could, the review of the change orders is, we spend a lot of time making sure that the numbers you're receiving from the contractor are fair. And what you don't see behind the scenes is us kicking change orders often back to the contractor to sharpen their pencils. So that falls into that credit. We still spend quite a bit of time making sure you're getting as fair a numbers as we can
Like I
get
said,
you.
I thought it was a very satisfactory answer. The other thing I had the issue with is exactly what Mr. Thompson had talked about as well, and that was the extended construction administration. And I talked about the fact that our staff was penalized having to working really not the best conditions for a period of time longer than we would hope for. And then suddenly it's like we're now paying an extra penalty on top of that. And it wasn't our fault that we weren't in this facility, you know, at the completion date. And so I still have a problem with that extended construction administration number that you got on there. I don't know if you want to address that at all, but.
I think the only way I can address it is we've tried to be tempered in that approach and not charge for all the time and kind of share that burden. That's all I can say. I mean, we have no way of getting that money from the contractor. We don't have a contract with the contractor. Yeah. So our contract is with the city. So that's our only remedy for the additional time that we've spent. And like I said, we've only charged for a small portion of that additional time that we've spent.